To you first, Tony Blakely, what do you take out of the announcement today about AstraZeneca from the federal government?
I think it's great. Been looking for this for about 4 weeks or so. The more people that we can get vaccinated now, the smoother will be our ride through to October when we get more mRNA vaccines. So as long as people understand the risk and they're willing to get AstraZeneca, great. And if we get some of our front-facing staff out there, people working in service stations, stores who spend a lot of time with the public vaccinated, that will be even better to help make us more resilient.
Dr. Khorshid, you've been quite critical and distanced yourself, or the AMA has distanced itself from the announcement today. What are your cautions about it?
Well, the announcement was quite a surprise to GPs around the country and to the AMA. And whilst there certainly are good points in terms of potentially speeding up that rollout, it does add to the confusion around the program because, of course, for those under the age of 60, our experts have recommended the Pfizer vaccine. So we've tried to really clarify that and say, look, the recommendations are Pfizer, but the vaccine, the AZ, is licensed for those over the age of 18. And if they are willing to take it up, then at least the Prime Minister has given them that option as of today.
And one of the other developments today in Queensland has been the fact that one of the people has been tested positive for the Delta variant up there is a receptionist at a hospital. Does that show that we've got yet another sort of hole in the web of people who need to be vaccinated in the health system? And how much of a threat is that, Dr. Khorshid?
So we've actually been steering away from mandatory vaccination anywhere in society, and we were pleased to see National Cabinet making the important call on aged care just yesterday, and also, of course, for quarantine workers. Healthcare workers are not mandated to have the vaccine, although those in frontline roles, especially in Queensland, have been told they must. A clerical worker in the back room does not have to be vaccinated, but it's still a really good idea, and we'd certainly be keen for all workplaces that are at that front line, that are exposed to many people coming through, thinking about whether their workers really should be vaccinated as we move towards the end of the year when vaccines are fully available to everybody.
And Tony Blakely, what's your take overall? I mean, it's a very scary picture at the moment with 4 big capital cities locked down. How worried are you about what's happening with the Delta variant in Australia at the moment, and has it escaped us?
No, it hasn't escaped us. Yes, it does look messy, but if you look at each of the outbreaks, I think with the lockdowns and other measures in place, we will get on top of those. As long as New South Wales stays in that lockdown until they get down to 0 cases occurring outside of isolation, we'll get through it. What we need to be focusing on now is getting through to October, November, once we've got lots of mRNA vaccine going into arms, and getting through that as best as possible. That means tightening up our quarantine more. It means that people that are low risk go to certain parts of quarantine, people at high risk go to certain parts, so we don't get mixing between that. It means that we further need to increase the vaccination and the measures on our quarantine staff and also on health services. If we can keep finding these improvements in the system and get ourselves through to October, November, that's the goal now, and then really kick up on the mRNA vaccine.
Omar Khorshid and Tony Blakely, thanks so much for your time tonight.
Thank you.
Thanks, Laura.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.